name's Jake Drumm, live here in Johnson City, Tennessee. I represent Drumm Emergency Solutions. It's a company I started back in 2016. Work to provide emergency care training and equipment to civilians and professional responders, kind of across the whole gamut of users. Stop the Bleed initiative was pushed out of the White House in 2015 as a response to all the school shootings and violence that was happening around the country. There was a consortium of folks that came together, sat down and looked at a lot of the attacks that occurred at schools and looked at ways to prevent death, sort of secondary to those attacks. That wasn't the only thing they did. They looked at other pieces of it, but primarily the Stop the Bleed portion was that collaboration of, if you have a school shooter, you have injuries inside of the school, are there things that bystanders can do to intervene and save some lives that might normally not be saved while waiting for traditional emergency responders? That's all kind of built around the idea and the statistics that show ages between 1 and 45 roughly. About 45 to 50% of those folks who are killed annually die of traumatic injuries, and a large portion of those injuries are from blood loss that's not controlled before care can arrive. So from all of that sort of sprung up the Stop the Bleed movement, sprung up some other training programs. One of those is called First Care Provider. Another is called You Are the Help, which is what the Tennessee Department of Health uses for their training. All of those programs, though, go out and train and equip sort of lay person providers in the same way that folks get CPR and AED training. You learn how to control hemorrhage, you learn how to position patients to help with their breathing, you learn how to prevent exposure and prevent heat loss and sort of stave off hypothermia. Just some basic skills that anyone can accomplish that gives that injured person a better chance of survival while waiting for transport to the hospital. Regardless of where you live, there's probably someone who's teaching Stop the Bleed. It's been well adopted, through fire departments, EMS agencies, hospitals, health departments. It's all over the country. The other program, First Care Provider, is also a nationwide program. Both of those have websites that you can find, stopthebleed.org and firstcareprovider.org. And there's information on there about how to find training. Here locally, I'm teaching Stop the Bleed, I'm teaching First Care Provider. There are other organizations doing that locally. And again, if you go to stopthebleed.org, put in where you live, it will come up with a list of folks locally who provide that training. The Stop the Bleed training program traditionally is provided free of charge. You'll find varying costs for that. A lot of folks just charge for the materials that it takes to provide the training. And coming up in May, we've got Stop the Bleed month, which is, I hate to call it a celebration, but it's a month of increased marketing and advertising to bring awareness to the Stop the Bleed movement and get folks out there trained up. So if you look for training throughout May, you'll find some larger groups. A lot of times they'll have those at colleges and universities and hospitals to kind of try and train mass numbers of people all at once. So the whole idea, much like when the idea of bystander CPR was rolled out, is just to get as many people across the country and really globally trained up as possible. That way, if there is an injury, there is an accident, regardless of the cause, folks feel confident to engage that patient and help deal with the traumatic injury and the bleeding that may have resulted from that. Stop the Bleed, and the idea with Stop the Bleed is intervening in any injury that's causing any life-threatening hemorrhage. So a lot of people talk about this idea that you can bleed to death in 3 to 5 minutes, and although that is technically true, with large-scale arterial bleeding, many times that victim has a minute or less before they become incapacitated. So it's very difficult for the person who's bleeding that severely to affect sort of self-rescue or self-care. They have a very limited amount of time. So the idea of the bystander involvement, motorcycle crash, someone suffers an amputation because they were hit broadside by a vehicle, that person may have other injuries, very difficult for them to take care of their own amputation and the bleeding that can result. So having bystanders who feel confident in providing the care, have the knowledge to provide the care, and have the tools to provide the care, that's the key component. And so overall, we're looking at potentially reducing the number of traumatic deaths across the country from all causes just by stopping this massive hemorrhage issue with many of these accidents and injuries. I would say that this idea of a traditional stop the bleed kit, there's a standard format that is put out by the American College of Surgeons. That's the organization that is behind stopthebleed.org. And what that standard template looks like is a tourniquet, so some kind of device to control hemorrhage in an arm or a leg. There's some gauze in there that's really specifically for packing of a wound in an area where a tourniquet cannot be applied. There's some kind of bandage in there, whether it's an ACE wrap or a more complex pressure bandage that allows you to apply a pressure dressing to a wound. Many times there's an emergency blanket, which is just a little silver Mylar blanket to help reduce some heat loss from your casualty or your patient. And shears, marker, few other odds and ends. Some kits have what they call a hemostatic gauze, quick clot. Combat gauze is one of those, and all that is some gauze that's treated with an agent that helps facilitate clotting. And some kits have what they call a chest seal, so if you have penetrating trauma to the chest or the back, it's essentially a great big sticker that allows you to seal that hole from that penetrating trauma in the chest or back, which helps the patient to maintain their normal ability to ventilate and breathe. So, Stop the Bleed really focuses on hemorrhage from limbs and the junctional areas, which are the neck, shoulders, and pelvis. These are the places that kind of a lay person, a bystander, can most effectively control hemorrhage. It's very difficult to control internal hemorrhage, as you might imagine. So penetrating trauma to the chest, the abdomen, stuff like that, we're kind of limited in what we can do with those basic tools. But we can certainly control hemorrhage in the limbs, which is a large portion of life-threatening hemorrhage. And the junctions, again, if you have penetrating trauma, you have bleeding that you can control with compression, so compressible hemorrhage in those areas. Wound packing with gauze and some pressure bandages is the way that we deal with that. So most hemorrhage control kits, stop the bleed kits that you find out there are kind of standardized. There are a wide variety of tourniquets out there in the world. I want to say the last time I sat down and counted, there's something in the neighborhood of 26 different commercially available tourniquets. But most of what you will find in a kit is the North American Rescue Combat Application Tourniquet. You will find the Tactical Medical Solutions Soft T Tourniquet. Those are both windlass style tourniquets, which is a strap and a windlass, which just allows you to twist the tourniquet tight. And then probably the third most common tourniquet out in the world that you will find in kits is the SWAT T. So the stretch, wrap, and tuck tourniquet. It's just a great big rubber band. And just for ease of understanding, this works in the same way as wrapping a string or a rubber band around the end of your finger to watch your finger turn blue. So all tourniquets just act to apply pressure on the limb above where the bleeding is occurring, and that stops the blood flow through the artery, which in turn should stop the bleeding at wherever the point of injury is. So when we think about a stop the bleed kit and we think about methods to control hemorrhage, we're just trying to provide pressure. So that entire kit is just devices and tools to help you provide pressure to where the bleeding is occurring. So a tourniquet just provides pressure and creates arterial occlusion pressure. So you're just closing off the artery to stop the bleeding to the limb. Wound packing, you're really trying to achieve point pressure at the point of injury, which is normally deep inside of that junctional area. So the idea is that you fill the void in the tissue with some gauze, fill that void as completely as possible, and that allows you to put external pressure that translates internally to where the bleeding's occurring. And then the chest seal really just seals a hole. It doesn't provide pressure so much as it just prevents air from moving from the outside to the inside of your chest and vice versa. So hemorrhage control kits can get very complicated. If you get out there and start looking around, there's a million different things you can have in those kits. Most of the kits that I build sort of follow the KISS method. I like things to be basic, simple. And when I got into this line of work, I was really trying to build a solution for my wife, who is a special ed pre-K teacher. So the idea was, if my wife finds herself in this situation, what are available tools that in that crisis, she could feel confident opening up this package, dumping it out on the floor, and taking care of someone who's bleeding. And so I build all of my kits from that standpoint. Most folks in extremis sort of revert to kind of a, maybe optimistically, a 3rd or a 3-year-old kind of level of thinking. And so the kits are built around you not needing to think. Large pictures, easy to apply tools and equipment in the kit. All very proven stuff that definitely works, and a lot of those things are things that I used when I was working as a paramedic years ago. So that's the premise of my kits. You will find kits in every conceivable color, fashion, size, shape. Marketing and advertising is the thing. So you have very basic things that are in a Ziploc bag, and you have very complex things that are in very fancy, shiny, expensive nylon pouches with zippers and snaps and buckles. So it's really kind of up to the user what they're comfortable possessing and carrying. The key to all of that is just knowing what you have and knowing how to use that. So there's a saying that kind of goes around, what is the best tourniquet to carry? The one that you have with you. So, know what your equipment is, know how to use it, know how to apply it to your patient. First quickest thing they can do is a combination of a couple small things. So number one, just be calm, right? The best thing you can always do in any of these situations, just to calm down. So maybe that's the answer to your question, is just calm down. Obviously call 911. I think that's pretty much ingrained in everyone's mind nowadays. 911 at least gets help on the way. So even if it's gonna take a few minutes, they're coming. And then, control any bleeding that you can see. If someone's bleeding enough that it makes you want to not be calm, that's bleeding that needs to be managed. So we manage that with pressure. So even if you only have a towel or a t-shirt or a blanket or a sock, use whatever you have and hold as much pressure on that bleeding as you possibly can.
This is Matt from Engine 7 Media. Thanks for watching. If you want to learn more about Stop the Bleed or purchase a Stop the Bleed kit for your home, school, or business, check out any of the following websites.